recently talk about a lot of probiotics, gut health, the gut brain axis.
Absolutely.
Okay, just to
My
stay
favorite
healthy. Favorite topic. Okay, so if you see, it's not new to us, because we have always had probiotics in our food in the form of neerakaram. In colloquially in Tamil we call as paresadam.
Palayasadam.
Paresadam. The overnight fermented rice water kanji these days they say, no, not the fresh kanji. It's the overnight fermented. Neerakaram is so much rich in probiotics. If you take it regularly, okay, at least weekly, 3 to 4 days you take it, scientifically the Western world we have papers that has proven to keep your gut health to the max.
Right.
And by that, this gut brain axis is another evolving concept. If your tummy is happy, your brain is happy.
Absolutely.
Your mood is happy.
Absolutely.
Okay. If
There
you
are
see
research on that is proven.
yes. Okay. So if you see a person who is constipated always, he's always annoyed, irritated with a bloated tummy. Okay. So they say if you take neerakaram regularly, it is so good. Okay. And neerakaram reduces your glycemic levels. Diabetic patients, it reduces your glycemic levels. So that is supported by an ongoing research which is going on in KMC. This year, government of Tamil Nadu has declared 2 crore rupees budget. It has allocated 2 crore rupees budget to work on this neerakaram. Imagine.
Wow.
Great news. And that's not something new to us. பழைய சாதம் சும்மா சொல்லி பழைய சாதம் ஒரு டம்ளர் குடிச்சிட்டு போ வயிறெல்லாம் சரியாயிடும். Granny keeps saying that. So I always
it's like so free of cost, but the same probiotic is packed up in capsules and then sell it over here for $10 a piece, and people are so fancy about it because it appears attractive.
Yeah, it's so I would say it is only decorated and given in a different form, but the best form is the palaya kanji, no? The palaya sadam is the best thing to have. That is taken along with shallots, the small onions. Chinna vengayam. Again, it's good for your gut health. It is so good for prevention of cancer, inflammatory bowel disease.
They'll do something like chinna vengayam plus palaya sadam, they'll mix it, la?
Yes, they will mix it, and they will have this more mulaga.
More mulaga, correct.
So good for your taste buds and for your tummy.
Absolutely, it's heaven.
So yes, this is one thing. And then we always had castor oil, the habit of taking castor oil once in 6 months. Okay,
castor oil,
velakkenna திட்டுவாங்கல velakkenna அப்படி எதுலயுமே ஒரு புடிப்பே இல்லாம வழிக்கின்னு போவாங்க. அவங்களால தான் திட்டுவாங்க velakkenna எதையுமே பண்ணாம இருக்க. But then it is on the lighter note, on a comedy note, I'm telling that. But velakkenna is so good for your gut health. So again, in a few years' time, I'm sure we will get evidences and research from the Western to support velakkenna as well. So once in 6 months, 1 to 2 tablespoons in the morning on a Sunday, this velakkenna will be given. And those days, you will only get bland food. This one's 1 day, 2 tablespoons of velakkenna, and the whole day you have to fast. Or if you're very hungry, after a few times you purge out, okay, you will be given a little bit of, more sadam, neer more, this kind of bland food. அதெல்லாம் பண்ணாம விட்டு ரொம்ப accumulate ஆனாதான் we are getting this sort of inflammatory bowel disease. All those free radicals and the unwanted slough and the mucosal, the sloughed out mucosa, if it settles down in the body, if it has to be eradicated at a particular time, it has to be flushed out. If it's not flushed out, then it is going to cause a lot of problems staying inside there.
Absolutely. I'll tell you an allopathic way of doing this as well. So, I am GI doctor. I have so many patients with abdominal bloating. You know what we do? We do colon cleansing. So for colon cleansing, it's almost similar to castor oil, but we give a prescription of like polyethylene glycol. We say that just be on clear liquid diet, which is your intermittent fasting or neerakaram, what you're saying. I mean, not neerakaram, but liquid diet. And then in 2 days later, so you mix the powder with water and you keep on flushing your system. and I can tell you that they feel like a better person.
Mm.
Right? All the symptoms, but it'll come back. It'll come back.
Yes.
So I think
So
that's
this castor oil is like advocated for once in 6 months. You can't do it every now and then.
yes.
Okay, so that is another thing that we used in our way of living. Food as medicine,
Mm.
for maintaining gut health. So that
Mm.
is another concept that I wanted to tell you. There is so much of the capacity for the Siddha system to bring in, even with economics. If you see, we can treat the entire world with the herbs that we have in and around Tamil Nadu. We
It's
can
actually
go,
even during COVID times, right? Even during COVID
yes,
times,
COVID
people.
times and dengue fever again. We
Right.
had neerakaram kudineer. We
Ah,
stood as Tamil Nadu stood as the model state in preventing and controlling the case when there was a rapid increase of
yes.
dengue case in 2006.
Yes. While you're talking about this point came to my mind. I really want to emphasize this. Okay, so during COVID times, we didn't have any allopathic medication to treat
Yes,
this virus, and
yes,
there was this kabasura kudineer that was available in Tamil Nadu and
yes.
many other states as well. So I know that was helping people, right? Because we didn't, because people got better. But at the same
Yeah.
time, I live in California. So in Indian stores, they used to get Gabasura Kudini from India and they used to sell it to people. And there was so much craze about that Gabasura Kudini. So people started drinking like crazy. And as a gastroenterologist, I saw so many patients with abdominal pain. So I go in with a scope. There was like so much ulcerative gastritis that I saw. So then I thought, okay, maybe it is related to Gabasur Queen. I think that is where the research needs to come in to see, hey, you know what, it is helpful. But
Yes.
what level, what dose, and that is what we need to put some money on and then try to promote this medicine.
Yes, we do have a structured dosage which the government of Tamil Nadu advocates to have
Mhm.
kabasura kudineer, but Tamil Nadu people are also a little enthusiastic to
Yes.
overdo it. So anything you overdo, even amudam becomes nanja. Okay,
Right,
so you
right.
overdo. I would
Absolutely.
request the viewers to just go with the dosage that you have. Even if you consult a doctor, you
Yes.
ask them how much of dosage is accepted, is
Ah,
permissible,
right.
and some amount of desirable side effects is there with all plant-based preparations. A
Mm-hmm.
kind of a loose stool, okay, a little loose motion is allowed, but that cannot continue. It cannot be something like a loose stools that you see in cholera, that you cannot allow
Right,
that.
right,
So desirable side effects is fine, but undesirable side effects is there with all the medications across different systems.
right.
So I would tell, yeah.
I cut you off with dengue. What were you saying about dengue? During dengue fever?
For dengue, we had this Nilavembu kudineer.
Ah,
Again, we have the government of Tamil Nadu had, made it mandatory for the decoction to be available in all the PHCs
is that right?
across Tamil Nadu.
Mm.
And it was during the time of Dr. J. Jayalalitha that this was widespread, advocated in all the PHCs. And you
Mm.
could see drastically dengue cases were hitting 1,000 per day. It
Mm.
drastically reduced in few weeks' time, and we
Mm.
stood as a model state for the
Mm.
rest of the country.
Mm.
So it made sure Nilavembu Kudineer effects are that it made sure that the platelets do not fall, and for patients whose platelet was reducing to the level less than 1 lakh, it started to increase.
Increase, huh?
All the hemorrhagic complications of dengue were
Mm-hmm.
prevented with Nilavembu Kudineer. So
Mm.
still, I would say we as allopathy doctors should pitch in, join hands with Siddha doctors, get them into the picture, and bring them all into evidence and science. Get
In,
the right dosage,
right.
and then the benefit that we offer the patients is like immeasurable.
I wanted to comment really quick on that dengue fever. So, let's take the Davidson medicine, right? That we learned during
Yeah.
MBBS.
Yes.
For dengue fever, under the treatment tab, what do we say? There is no treatment available. No treatment. Davidson is the Bible of medicine. Even there, treatment says there is no treatment for dengue. Symptomatic and supportive therapy. You have fever, give paracetamol. So I think this is where the integration should happen. Maybe you should write a book, Ajitha Porkodi book, and then say that, okay, treatment number 1, Nilavembu, kudineer. Second would be paracetamol for fever. I think that is what should happen.
Yes, definitely, Pal. Yeah.
So moving to the next, I want to wrap it up before an hour so that doesn't go too long to be condensed into. All these are beautiful points, but I want to wrap it up with this point about cancer. So there is no medication to prevent cancer from an allopathy standpoint. We know the lifestyle changes does that. How do you see in your setting, and what is the cancer patients that you are handling with? Please shed some light on that.
Okay. Now, see, if you see for known diseases itself, it's very difficult to, to have a cure for the patients, because cure is the final thing that any patient is wanting for. But then we are not magicians to give, a magical remedy. Okay, it is a coordinated. The doctor-patient relationship should be intact. They should follow the counseling. They should follow the diet. They should follow the medications on time. So there are so many efforts that has to go into to come to the term cure. So like that, for the known devil, it's like this. Cancer is an unknown devil. So so that has different dynamics, because cancer is very unique. Again, it is also like idiosyncrasy, right? Like if 10 people get cancer of the same type, 10 people with treatment respond in a different way. Although we give the same amount, the kind of chemotherapy, we give the same amount of radiation, but the outcome is different.
Yes, based on the individual.
Yes, based on individual. Okay, it's the way your immunity reacts, right? So, for the viewers, I would say cancer sprouts out in a person only when your default systems that is called as cancer immunity. There are some genes in our body that will prevent cancer from happening. Okay, cancer doesn't happen in a day. Okay, it takes many days and years together to accumulate, and for that abnormal protein to sprout out to a very fastest replicating cell. It takes years and years to develop. So on that note, I would say when the gene that is preventing cancer fails, your cancer will sprout out. So for cancer, I would say integrative medicine is going to be a boon, because allopathy system has very good randomized trials, and the dosage and all those things is fine, but then still we are not able to bridge the gap that is at the end of the treatment. We will say so many number of cycles of chemotherapy, radiation therapy, or a neoadjuvant chemotherapy, surgical removal. After all these, still we fail to give the cure. There comes integrative medicine. There comes Siddha medicines, which are plant-based, and they have phytochemicals, naturally occurring phytochemicals that has tumor necrosis factor, that helps in chemo prevention, chemo protection. I can list down a couple of the native herbs that are So for example, if you see, all the randomized trials are available for few of the herbs like Tinospora cardifolia. It's used in homeopathy. It is used in Siddha as well. It is in Tamil. It is called as Seendal.
Seendal.
It is a kind of a creeper. So this Tinospora cardifolia, which is native to Siddha medicine, it has a lot of anti-cancerogenic activity for prevention and for the residual disease treatment as well. So that it has anti-inflammatory and anti-cancerous properties that has been recorded in a randomized trial. So that is one. Turmeric, again, we know turmeric left, right, center, we keep using. So turmeric again has anti-inflammatory and anti-cancerogenic property. And then there are few herbs that enhances the apoptotic activity of the tumor cells, not the normal cells, the tumor cells. So a few other things are nuna. There is a herb called as nuna. There is amukura. There is amukunankirangu. It is a kind of a tuber variety. Amukunankirangu, it is so good. Then you have vilvam. If you have seen, we sacredly we give it for Lord Shivan.
Right.
So that vilvam is so good. It has anti-cancerous property. There are so many umpteen number of herbs that we day in and day out. We have Nilavembu, another variety of neem that is seen in mountain ranges, and then there is Roma Viricham. There are so many,
So help me.
we have evidences. As you asked, randomized trials are still there for all those things, still evolving. The science is still evolving and finding out the balance where we can, validate the, for the use of larger population, we can validate the herb, we can validate the phytochemical, and I'm sure in a couple of years we are going to get more and more of herbs. These are very few, basic herbs that I'm telling. Tulasi, again, it is very good. Tulasi and karundulasi, and even grains. If you ask kauni arsi, the black rice, it's called the royal. It's called the forbidden rice. If you in Chinese system of medicine, it is why grains are available throughout the Asian countries. So whatever, some will be, there will be overlaps here and there between Chinese and Siddha medicine. And Ayurvedic medicine. Ayurveda is mostly followed in North India, but South India, which has even an older tradition and dates than Ayurveda. Siddha is even older than Ayurveda. So it is as old as Chinese medicine. So kauni arsi, the royal, the forbidden rice, which will be consumed only by the royals in the Chinese. So that is again having a very good anti-cancerous and anti-inflammatory properties. It's a part of cancer. So that's why all these herbs have both the properties. So all the apoptotic and tumor necrosing factor activity is there in many of the herbs.
So help me understand this. So you're saying all this plants. So let's say that I'm a cancer patient. I'm just saying, then I come to you that, hey, you know what, I'm trying allopathy. I said I want to do. So all these herbs that you're saying, how is it available? Are you preparing it by yourself, or what's happening?
Okay, so what we have is, we do have two major government setups. For example, I would say IMCOPS. Okay, there is a company called as IMCOPS in Adyar, and there is SAMCOL. With both of these are run by government of Tamil Nadu. It is a structured. They have structured pharmacopoeia. It is all licensed, and it comes out after a lot of clinical trial behind. So we have umpteen number of preparations that we have, we source out from these places, from these two, cooperative societies. It is by the government, so it is very much, all your doubts about the side effects and all those things. It's all tested. It's the efficacy of the product is tested, and it has the way, the protocols. There is SOP to maintain the quality of the product. Everything is in place. So we usually prescribe medications that are either from IMCOPS or from TAMCOL. So that will be in the form of, there are a few mode that you give the medications. Some phytochemicals are very good in the form of syrups. Some phytochemicals are good in the form of arikshas that we call as arikshams. Okay, that is the syrup. And some are good in the form of layhiums. So again, on that note, all the layhiums we make a base as ghee. And ghee, as you very well know, again, Westerners have proven clinically that it is a very good source of medium chain fatty acids, and it is so good to have ghee every day. And ghee again has anti-cancerous property. I would like to integrate the Western and the Party Vaidyam, the grandma again here. They say, everything was said through proverbs. They say, neerilla netripar, neyilla undipar. That means if you don't have godliness, and if you don't apply the sacred tiruneer, neer means tiruneer, then your life is of waste. And neyilla undipar, the food that you eat, if it is not having ghee, then it is of no use. So now we see papers that supports ghee has anti-cancerous property. It has anti-inflammatory property for most of the autoimmune, the problems that we have in the gut. The anti-inflammatory property of the ghee will combat all the immunogenic, immune-mediated inflammatory bowel disease that we see because of lot of other factors.
Nice, super. I think it is just a beginning. I think it is just a beginning of this integration. We are at such a baby stage. There is so much to be done in this field. If I am an obese patient that want to lose weight, if I come to you, or most of our audience are interested in intermittent fasting and everything, so one summary or one sentence or one guidance that you can tell us, like how to integrate our approach with you, what will you tell them at this time?
I would say, as you always, you keep saying that, I would say you have borrowed my some of my advices already in your videos.
Exactly.
Because on the right path, you have already started to integrate even without your knowledge that you are doing an integration. So food, whatever you eat, will be reflected in your body. Okay.
Food is the medicine.
So, food is the medicine. So be mindful in what you're eating. Mindful eating helps prevent obesity and to treat obesity as well. So eat mindfully, and I would say there are some as horse gram, shallots, varathandu, banana, the plantain, the stem, the banana stem is so good for obesity. Varathandu is good because, as you know, if there is too much of adipose tissue, there's going to be a lot of water retention. And this banana stem in the form of soup or kootu, it is so good. So people who are obese, please adopt the habit of having banana stem kootu or poriyal at least weekly twice. Take a lot of roughage. Roughage, again, it's very good for your gut health and to remove the excess water from your body. That is another thing. So all sorts of keera will come into play. This kalavang keera, mixture of keera, then murunga keera, modakatan keera, all those things. So obesity can give you a lot of joint issues, joint pain as well. Modakatan means modakku aruthan. So modakku means, modakku we say, modakku means it's a debilitating problem. If you have a joint issue, you will be debilitated. That's what is modakku means. So modakku aruthan. So this aruthan will cut the cycle that is causing the modakku vadam. So that is, again, modakatan is very good. You can take it in the form of dosa. In dosa, you take fresh leaves of modakatan. For a family of 4, you can take 2 handful of modakatan. Just chop it into fine, leaves, and then add it along with your dosa mawa. Have it like a normal dosa. That's good. And modakatan again, and with in 100 ml of boiling water, you can take a handful of modakatan, chop it off, put it in the water, boiling water, let it condense to 50 ml. Just add pure honey if you happen to get, or if not, don't have honey also. Just take it as a raw decoction. That again, weekly, twice or thrice, this modakatan is very good, both to weight loss and for all the joint issues that any obese patients are facing. And that is another thing. And I would say ginger again. I would like to, like any time, any other time, we can possibly sit down and work out all the
I was about to say that you should do a YouTube channel by yourself.
Oh.
There's so much content in this video. I think the reason for doing this in English is because most of the 25% of the audiences are non-Tamil speaking in my channel.
Yes.
But we should do a separate Tamil version as well, because it's all like Tamil medicine.
Yes, based in Tamil. So we will address to the Tamil audience as well. So this ginger, let me come to the point. Ginger is again very good for your weight reduction. But ginger, again, when I say that, I would want to give a heads up to our viewers, because ginger, as you know, raw gingers can be little pungent. It can be little irritant to your stomach. So again, don't land up too much of consumption of ginger and then don't land up in any sloughing of mucosa or any
That's right.
dysentery. So
Right.
yeah, so ginger, the permissible level for obese patients and what form they can be taken is ginger and garlic can be used as a ginger garlic paste in day in and day out your food. That is one way of taking ginger. 1 tablespoon of ginger garlic paste a day will keep you healthy. And number 2, ginger in the form of ginger milk is very good for obese people. I would say in the morning or around 11 o'clock, you can make this ginger milk. So how you do is ginger, you take about 1 inch of ginger, just peel the skin and smash it. In a boiling water, 100 ml of boiling water, add this ginger, let it come to a boil for about 3-4 minutes, and then take a 100 ml of glass, fill at least 50 to 60 ml of this ginger decoction, the one that you strain it and then take it, and then add 25 ml of milk to it. At that time, I would say don't add the milk to the boiling ginger decoction. You take it off the fire, strain it, so 50 to 60 ml of ginger decoction with 25 ml of milk and a pinch of cardamom will do wonders.
Nice.
This is not a magical medicine. Over a period of time, it will start working from inside. The healing will start from inside. It is not like your paracetamol. You take 500 mg and then your headache is gone in 15 minutes. It doesn't give you instant results. The results are going to be accumulative effect. You have to do it over a period of time. And please, not more than 90 to 100 ml per person. So again, and per day, once a day is enough.
Super.
And somewhere between minimum three days a week to 4 to 5 days a week, this can be followed.
Nice.
Okay. Varakandu, I told you. Then ginger milk, I told you. Then other than that, there are other medications that are available in the form of tablets, which would aid and
in increasing the metabolic rate.
So that's also available. Please, you go to a certified Siddha doctor and then you get.
What's the name of your clinic? Modern Siddha Institute.
It's called Modern Siddha Specialty Clinic. Yes, and we do have a separate branch for Modern Siddha Cancer Care Center. It's all, I mean, like both the centers are there in T.Nagar, and we've been based in T.Nagar for the last 50 years.
Nice. Super. So good, Akka. So good. I mean, it's a longer interview, but I think there is so much content that I couldn't condense to.
I can go on and on.
No, I think absolutely there's so much content. I think bottom line is, I'm just going to summarize all this for you and tell me whether I'm wrong. So number one is, I think the future is integrated medicine with allopathy and Siddha or Ayurveda or anybody, but which I completely agree with as well. I think that is how it should go. And number two is, for acute situations, allopathy is the best. For preventive care, maybe I think there is a role for this integrated medicine. And number three is that I think
maybe it is. It does have a great role
for us. We have to figure out which way that it has to fix in this particular.
Preventive as well as treatment of all the chronic complaints and the lifestyle-oriented diseases. We do have very good treatment options, which gives you the clinical, outcome is very good. It's cost effective. Again, as you're summarizing, I would also want to say that Siddha medicines, they are plant-based medicines. As you know, even in allopathy, we have medications extracted from plants, from animals, and from marine species. And we also use metals in allopathy also.
Right.
We do use zinc, we do use iron, we do use gold for treating arthritis.
Yes.
We do use the same, kind of metals. The one common thing that I always face in my clinical practice is, even my allopathy doctors, all my friends, they keep asking, metals Siddha? There's a lot of metals in Siddha. No. Nobody is going to get iron, make it into powder and put it into your mouth. No, it's not like that. We have our own pharmacopoeia. Siddha has its own pharmacopoeia where these metals are treated with umpteen number of herbs that acts upon the metal to detoxify the side effects of the metal, and it makes the preparation palatable for a patient without the undesirable effects of the medicine. Possibly, if the medication is not prepared in the right way, it may give a problem. But then IMCOPS and TAMCOL, both institutions run by the government, have these SOPs where they, after the preparation of medicine, they check whether the medicine has toxicity or not, whether the medicine is done in a way it has to be done or not, in the traditional way. So the medicines that are prepared in a traditional way do not give you the undesirable effects.
Nice.
It is all structured. Only thing is that it has to be taken. I mean, like patients should reach out to the registered practitioners, not quacks. Have a check on their degree, whether they are the right people whom you should meet. So you see them, ask them questions, ask them what is the desirable dose. Okay, don't self-medicate. If at all, if there's all people who go on Google, just don't go blindly take kabasura and loads of liters and liters of kabasura kudineer is only going to land you up into a gastroenterologist like Dr. Pariniyappan.
Thank you so much.
Please make a note of how much is the desirable amount that you have to take.
Right.
That is another thing. And Siddha is very much sustainable. Siddha medications, because we prepare from plants, animal sources, marine sources. That is, again, you should go to the right doctor and the right dose has to be taken. Okay.
And then you confirmed my intermittent fasting technique as well.
Yes, intermittent fasting, again, supported by, I mean, it's a new concept, which is like a wildfire after Pal's, propaganda, but then...
in your medicine, in your Siddha medicine as well. That's the key information.
Yes. Intermittent fasting, definitely that the proverb I said, eat one time, you will become a yogi. Eat twice, you'll become a good human being with a longevity and with mobility. Okay, disease-free you can live, but don't, sunrise and sunset. You remember that, remember Dr. Pal, and I'm sure you will all have a good health. And Siddha is recyclable. I just wanted to tell a few concepts, which we may have not heard it from our ancestors, but now because I'm integrating, I'm trying to, conceptualize what Siddha is. Siddha is traditional. It is the traditional medicine of Tamil Nadu, is on par with the Chinese medicine history. Okay, but we only need to add science to it, bring them to the light, and it is sustainable, it is pollution free, it is recyclable, it is, the carbon footprint out of the manufacturing of all the Siddha medications is very, very less, by which you're going to save the, you're not going to harm the earth's environment more. It will use renewable sources of medicine, and it is cost effective, it is clinically effective in treating the disease, and it has very, very minimal and desirable side effects. Please, for heaven's sake, don't. This is a very, very famous myth that Siddha medicines have metals, and it is going to give huge number of, a huge amount of side effects. It is absolutely a myth. Let's break the myth. Okay, let's respect our tradition, add more science to it, bring all the evidences on table, and treat more and more patients. And and we will prove that our tradition is far more ahead of what we do.
Super. Sounds good. Thank you so much. That was a wonderful session. I'm pretty sure there'll be lots of questions in the comment section. So please drop in and we'll be happy to answer. And I'll definitely bring you back again in one more session. We'll discuss more. Thank you so much for your time, Dr. Ajitha.
Thank you so much, Pal. And thank you so much for all the viewers. And I would like to hear a lot of, I'm sure still all the viewers will have at least 1 to 2 questions. Please shoot them in the comment section. We are there to help you. And thank you so much, Pal.
Thank you. Bye-bye.
Bye.